quienes están conectados. Vamos a esperar 2, 3 minutos más mientras terminan de conectarse. Muchas gracias por estar aquí con nosotros. Bueno, buenos días a todos los que nos saludan en el día de hoy, a quienes nos acompañan en este webinar.
Good morning to everyone. And it's a pleasure to have all of you here and joining us in this webinar. This event will have simultaneous interpretation in Spanish and English, so please choose your language of choice. When in the little globe at the bottom of the screen, select your language. On behalf of the Pan American Health Organization, I'd like to welcome you to this virtual seminar, Annual per capita consumption of alcohol in the population, a measurement tool to support public policy. My name is Mario Alberto Zapata, Regional Director of Alcohol and Psychoactive Substances in the regional headquarters of Washington, D.C., and I have the honor of moderating and presenting this event today, which would not have been possible without the support of our very distinguished presenters, whom we'd like to thank for their time and dedication to today's effort. Also, thanks to the team of the Department of Non-Communicable Diseases of the Pan American Health Organization, and of course, all of you in all your countries who are with us today. I'd also like to thank the offices, the regional offices in the Americas, and their representatives, advisors, consultants, and assistants who have supported the organization of this event. And in particular, we'd like to thank the focal points of the governments in the region for their participation, who are the purpose of this event. At the end of our virtual seminar today, we hope that you, as participants, will recognize the importance and will acquire certain skills to calculate and monitor the annual per capita alcohol consumption of alcohol in your country's tool, and recognize the importance of this tool to assess the effectiveness of public policies that seek to diminish alcohol consumption and improve the health of the population. This webinar is being recorded and it'll be available on the YouTube channel of our organization and will also be available on the web page of this event. In the chat, you will find the links to YouTube and the link to the web page of this event. Next, I'd like to briefly mention the schedule for today, where we expect that you will be with us for an hour and a half. And you can ask your questions and concerns, but place them in the chat. And as much as possible, we will try to combine certain responses. This time allows it us. And if not, it'll be input for organizing future events. So thank you for your participation. Today, we have Dr. Renato Oliveira, Chief of the Mental Health and Substance Use Unit at PAHO. And we will then speak about the context, the global strategy and action plan to reduce alcohol consumption. That will be presented by Dr. Juan Tello from the World Health Organization. And then we will have a discussion with Dr. Kevin Shield, who, as a result of his experience, will speak to us about the importance and benefit of this APC indicator as a means of determining the levels of alcohol consumption and the disease and mortality burden attributed to alcohol in the population, and how this relates to the goals of the sustainable development. And following that, we'll have economist Norman Maldonado together with Juan Camilo Herrera, and they will speak about their experience to refine and achieve the calculation of alcohol consumption in a population. And we will conclude with a presentation on the virtual course available on our virtual campus so that you can review some of the concepts and so that it can support you in monitoring public policies that seek to decrease alcohol consumption in the region. Likewise, decrease the impact on disease indicators. The consultant of PAHO in Colombia, Leonardo Garcia, whom we'd like to thank for the support, will conclude with a summary of the session. So without any further ado, let us start. And I'd like to invite Dr. Renato Oliveira, head of the unit on mental health and substance use unit of the Pan American Health Organization in Washington, to open the session. Thank you very much, Mario. Good morning to everyone. On behalf of the Pan American Health Organization and our Department on Non-Communicable Diseases and Mental Health and the Unit of Mental Health and Substance Use, we extend a very warm greeting, and I'd like to welcome the participants from all countries in the region and thank you for the valuable support made by the presenters today to expand your knowledge on this topic. For the Pan American Health Organization, it's very important to provide technical support and information so that countries in the region and those responsible for public policy can have trustworthy and updated information on the health problems that should be a priority to improve health outcomes in the population. The use of alcohol is one of the main risk factors for public health, and the decrease of consumption and the intervention to achieve this should be a priority to decrease the mortality and disease. In the world, 2.6 million deaths per year are attributed to consumption of alcohol, which represents 4.7% of the total number of deaths. Alcohol consumption in the region of the Americas is more or less 40% greater than the global average. And as a region, we represent the second highest consumer level, only exceeded by Europe. With given this reality, it's essential to have tools and data that are reliable in order to monitor and develop public health policies that are effective, that allow us to make uh, reliable decisions to reduce the consumption of alcohol. The annual per capita consumption of alcohol, topic we will be discussing in this event, has been established as the most reliable indicator to allow us to monitor trends in alcohol consumption. It is a key indicator, not only to understand the dynamics of consumption in the population, but also to assess the effectiveness of any policies implemented and to determine whether it aligns with the SDGs. The per capita consumption per year in terms of pure alcohol is one of the indicators of the 3.5 health goal of the SDGs to strengthen health and reduce the use of substances, like active substances and alcohol. That is why we've organized events such as today's. It allows to contribute in an effective manner to addressing this problem and improve our ability to monitor it and therefore develop good public policies that have greater impact in reducing alcohol consumption. Again, I'd like to thank the participants, particularly the focal points of the institutions in our region's governments and our country reps as well, the presenters that have been invited, the panelists, the organizers, and support staff. We hope that this seminar today will fulfill your expectations and will allow you to improve your knowledge of this topic so that all of us can implement strategies that allow us to decrease alcohol consumption and thereby improve the health of the population in the Americas. Thank you very much for your participation and best wishes, success in this day. Thank you, Dr. Renato, for those words. I now have the pleasure of introducing Dr. Juan Telo. Dr. Telo is the head of Less Alcohol Unit of the World Health Organization, uh, located in Geneva, Switzerland. Dr. Tello today will talk about the context of the regional strategy and the plan of action to reduce alcohol consumption. Welcome, Juan. You have the floor. Thank you very much. Good morning to everyone. It's a pleasure to be here and speak to you at this event. I'd like to thank the organizers as well for having been invited me to participate. The what I will be speaking about today is global, but it has a bit of a regional flavor as well. And I will begin my presentation. So let's begin with the good news. The global trends in general on alcohol consumption per capita has been good in the last few years. It's been a trend that aims to meet the SDGs, which was to reduce per capita consumption globally. This is the data we have up until 2019. The projections after 2019 are not as good as we see here, but we don't yet have official data. Dr. Renato mentioned that the consumption of alcohol has an impact on our health. And we talk about 2.6 million deaths in 2019, which amounts to 4.7 total of all the deaths attributed to alcohol consumption. How we attribute this is part of what Dr. Shields will talk about in the next group of presentations. Who is most affected? Generally men, who are the ones who drink the most and are more predisposed and exposed to the damages caused by alcohol consumption. But when we look at this with a more equitable lens, it is the younger generations that are affected, and the and also the lower socioeconomic levels are most affected. And later on, we'll see how this translates to each country. How do we know that we have 2.6 million deaths in 2019 due to alcohol? Well, you report to WHO through the regional offices the number of deaths, and from that we do some estimates and we do comparisons and validate them through other sources of information that you see at the bottom of this slide. And then we report to the global alcohol and health surveillance system, which is accessible to all of you. We usually call it ISA. This system also allows us to prepare the global report on the status of alcohol and health, which is mandatory for the organization, and sheds light on the work done not only by the Secretariat, WHO, and the regional offices, but also by the member states. Another important point, and Renato had referred to this, is that these are the statistics that later serve to inform whether we are attaining the SDGs of the UN. It also establishes the voluntary goals on non-communicable diseases and other documents. So when we talk about 2.6 million deaths and how they're distributed, how they're made up, you can see it on the right-hand side of this pie chart, where you can clearly see that under communicable conditions in the blue, you can't see the percentage on the screen, but it represents about 22%. Then you have the malignant neoplasms, cardiovascular diseases, and as you can see, a significant portion are digestive diseases in general. You can see that in the region of the Americas, as I said, the average per capita consumption for the year 2019 is 7.5 for us and 7.6 at the regional office. There's a slight difference in the number that we have to adjust. When at the global level, it is only 7.7, excuse me, is only 5.5% worldwide. It's 5.5 liters per year for what we consider adult, which is 15 and over. You will see in the next presentation more detailed breakdown. But if we have 7.6, 7.5 in the Americas, which are the countries that are at the base for the statistics?
You can see it on this map. In red, we have the United States, Canada, Argentina, Chile, and some countries such as Barbados, Grenada, and Panama. However, we're going to see a very good indicator about actual consumption in the region. But if we look at this under the lens of equity, the indicator describes consumption, but not necessarily the actual burden of the diseases. So you can measure the burden from various perspectives. I have used um, years of life with disabilities, which allows me to relate this information more easily. When we carry out this type of analysis in the region, we realize that those countries having socio-economic differences which are important have a greater burden. And we tell you this because we said that the lowest social classes are the ones that are affected the most. That's what we call the paradigm of alcohol consumption. So you see that all the countries in Central America start having important relevance, such as Brazil, also Brazil, Paraguay, and Chile. Another piece of good news is that this is not something strange, and global policies and health policies have tried to hold a public health approach in this type of interventions to prevent this burden socially, not only as regards health, but also the social, cultural, and economic aspects are considered therein under. In 2010, the job started earlier. By 2010, we had the first global strategy to reduce the deleterious consumption of alcohol. And there was a great effort in reaching this commitment internationally, with countries that were pulling in one direction, others pulling in a different direction. And the document is an important reference framework for all of us. And it's still very valid, as you will be able to see next. There are indeed other global agreements, including the SDGs, of course. And this later on was translated into the so-called best buys with WHO in 2017, which was then updated in 2023. In 2018, a specific package was prepared called SAFER. All these slides can be shared with you, and you have all the links to the documents in the various languages, particularly, especially in English and Spanish. You also regionally, this is what you see below. There are some important documents that register this movement on a global basis, which also describe the situations on the national level. Coming all the way to 2022, where after the global assessment, we came to the conclusion that it was necessary to thrust this strategy, and the Secretariat of the World Assembly asked the Secretariat to prepare an action plan, a more concrete action plan. So, for the sake of the global strategy, what is important, since you know that this is a multidisciplinary approach, which speaks about mortality, but morbidity as well, dealing not just with the sanitation aspects of public health, but also its social consequences. It is therefore requested that there will be steps taken with regard to consumption, the context, and the various consumption patterns, as well as the social determining factors. Later on in 2015, we dealt with the development goals, and this is very clearly shown. We'll see the congruence of these policies. And in 2015, as I say, the 3.5 goal was created. Now we're dealing with 352, which has to do with alcohol consumption per capita for the calendar year, or pure alcohol consumption. What were the lessons learned that led the Assembly to request the preparation of a global action plan. In the last few years, we've seen a globalization in alcohol consumption, the need of having a global standard as opposed to tobacco, where the fact that there's a trade-off between health and the economy, the influence of trade interests, and the complexities of the issue, which is not just a matter of saying we have to do away with alcoholism, but rather the whole cultural and social background. We cannot deny that there has been a lack of will and political leadership, not through ill intentions, but rather through ignorance of the actual nature of this problem, which is so broad. Intersectional approaches for which our ministries are not necessarily trained for, or they are not part of the ADN of many of our governments. The digital factors and the limited surveillance and monitoring capabilities, we have come to establishing this global action plan, which has a goal. It has operational objectives, principles, areas of action that I will be dealing with later, goals and indicators. I will skip over all these objectives, which in looking at the actual profile of our participants, I think you're well aware of them, especially as regards the relevance of having operational goals in order to take care of the family, communities, and nations from different viewpoints, including not merely health, as we have heard, but also multi-sectoral dialogue, as well as its impact upon families and communities. These are the operational principles, therefore, with which I'm sure you're very familiar in the Americas, perhaps less in other regions, and this is why we have made this clear in the Global Action Plan. What are the areas? Which is a very important aspect. First, the implementation of high impact strategies and interventions. I will delve a little bit on this. Advocacy, concentration, technical support of capability systems of knowledge and mobilization of resources. All of these areas respond to the assessment made and which was the source of the need to prepare this global plan of action. However, you will be recognizing many of these elements in the global strategy, which is still in force. So the way in which these action areas are organized is an introduction which summarizes some activities. Each one of the areas has its goals, indicators, and objectives for the member states and for the secretariat. And this is something innovative with regard to the strategy, but also for the partners of the UN system, professional associations, the academy, and civil society. This also has measures and steps and economic operators who deal in the production and trade of alcohol. In the first area, you will see the first indicator, which we have here, is to reduce by 20% alcohol consumption based on the year 2010. In other words, there is a coincidence with regard to this indicator, because it is the one which enables us to establish with a certain degree of certainty what will be the annual consumption and make estimates of the possible damage and disease burden for the countries. And 70% of the countries, by the way, will have introduced by 2030. That's the follow-up of the plan. 70% of the countries will have introduced and maintain the implementation of high-risk intervention. What are those interventions of high risk? This incorporates the best buys, these 5 that you see here, plus others which are not only cost-effective, but which are the ones that you see up front, and I will delve further into the details of this point. In a virtual course of PAHO, you will find this in the virtually that to which you have access. Alcohol availability, and I have accompanied this with some of the most recently produced documents, which are in English commonly, but they are readily translatable with Google, and also to adopt measures against alcohol driving or driving under the influence. Also, the international screening, treatment, possible interventions, and measures that tend to restrict or to ban entirely everything that has to do with the trade, promotion, sponsorship of events having to do with sports. And the fifth of this is to increase prices by way of taxes and pricing policies, eliminating and reducing subsidies for economic operators. The whole package that we have developed in order to give support to countries seeks to implement these elements, the monitoring and protection and implementing elements which are not merely technical, but which also have a whole scheme and a set of implementation elements and how to deal with the various interests concerned. I will stop here to allow our other presenters to tell us about this topic. And besides the actual course in the virtual field, we also have a policy brief which you can consult online. And I leave you here with the information for you to find the link. Here's the link. Thank you so much. Thank you so much, Dr. Juan Tello, for your presentation. Dr. Juan Tello has presented us and spoken about the importance for the World Health Organization and the joint effort together with the Pan American Health Organization they have carried out regarding all these topics for them to become a priority in the work that we conduct worldwide. You have told us about the situation of disease and death resulting from alcohol consumption and the problems with information systems and the data that countries must collect in order to support worldwide surveys and thus be able to take decisions regarding alcohol consumption. We thank you all for the greetings you have given us through the chat from Central America, the rest of Latin America, South America, the Caribbean, and some persons also from North America, Puerto Rico, and other countries as well. Next, we have Dr. Kevin Schill. Dr. Kevin is part of the health policy research team, mental health in the Center of Addiction in Toronto, and he is the director of the collaborating center of PAHO and WHO in that institution. Dr. Schill is an advisor and speaker in many of these topics. He's a very outstanding scientist. He will tell us about the importance and relevance of the per capita alcohol consumption to determine the consumption level, alcohol consumption level, and the burden of disease attributable that can be attributed to alcohol and the connection this has with the global development goal. You have the floor, doctor. Go ahead.
Great. Hi, everyone. My name is Dr. Kevin Shield. Thanks for the introduction. And today I'm going to present on why adult per capita consumption is the best, most accurate, most reliable, least costly, and most responsive indicator of alcohol consumption out there. and hopefully encourage you at the country level to monitor it at least annually, and more likely than that, monthly or even weekly, as it provides a wealth of data for you to assess alcohol consumption and alcohol attributable harms at the country level. So with alcohol consumption, we sometimes frame it in terms of the importance in relation to the Sustainable Development Goals. Alcohol causes a large health, social, and economic burden. So causes, as you know, 2.6 million deaths every year. It also causes a tremendous amount of social harms and economic harms. Alcohol, unlike other risk factors like tobacco, tends to cause mortality and morbidity among young people. So there's a lot of loss in terms of the working population, as well as a burden on the criminal justice system and healthcare system that's caused by alcohol as well. And this leads us to the Sustainable Development Goal 3.5. There's a need to strengthen prevention and treatment of substance abuse, including narcotic drug use and the harmful use of alcohol. So with that in mind, how do we measure the progress towards achieving that Sustainable Development Goal? Well, I propose that the best way to do so is to measure adult per capita consumption at the country level. And that's what my presentation is going to outline today. One, the importance of adult per capita consumption. Two, the data sources used to measure adult per capita consumption. And then three, how we can improve upon the measurement of adult per capita consumption with a specific look at the Americas, because different countries face different problems in terms of the measurement of adult per capita consumption. So why use adult per capita consumption data? There are many other measures out there. And these measures include heavy episodic drinking. So that would include things like binge drinking, heavy continuous drinking. So that would include things like consuming 5 or more drinks on average every single day. So very heavy drinking. We have alcohol use disorders. So people who have alcohol dependence and need treatment, that's also a good indicator. And then lastly, we have past year drinking. So all of those other measures that I just mentioned are survey data based. They're great and they should all be measured. But the reason why adult per capita consumption is better than those measures is that it is more accurate measure of alcohol use in that it doesn't rely on population surveys. Population surveys underestimate about 70% of alcohol consumed. So when you do a survey and you add up all the consumption among your respondents, that only equals about 30% of alcohol consumed in the country. So you're missing in population surveys around 70% of the alcohol consumed in a country. And we know that because we're comparing it to sales and production statistics from adult per capita consumption. And so if we rely on surveys, we're missing a tremendous amount of alcohol consumed in a country. Next, survey data don't just underestimate alcohol consumption by about 70%. They do so inconsistently. Some surveys will measure 20% of alcohol consumed in a country, and some surveys will measure 40%. And this isn't a phenomenon that we just see across countries. This same exact survey, over time, you will see a trending decrease in the coverage rates. So even if you have stable alcohol consumption, the decrease in response rates in surveys paint a picture that alcohol consumption is going down, where it could be stable or it could be increasing. And therefore, we shouldn't rely on survey data if we have adult per capita consumption data. The next factor I want to bring up is how alcohol use is related to the occurrence of disease. You can see that the volume of alcohol consumption is the most correlated to all causes of disease, where heavy episodic drinking occasions are only related to fewer diseases, particularly injury, ischemic heart disease, and other cardiovascular diseases and infectious diseases. Furthermore, heavy drinking occasions when it's
Además,
related, oh, sorry.
cuando,
Okay, sorry, I'll continue. So when we look
Ade-
at the heavy drinking occasions, it's not related to the disease categories as much as volume of alcohol consumption. And that can be seen in the next graph. So here we have adult per capita consumption, and here we have alcohol attributable deaths. You can see that it's a fairly tight correlation for adult per capita consumption, which is on our left. When we look at the right, which is the prevalence of heavy episodic drinking, you can see it's a very wide distribution. So adult per capita consumption is the most reflective of harms in a country when compared to heavy episodic drinking. This does not mean we should not measure heavy episodic drinking. It is a great indicator of alcohol harms. It's related to things like injuries very strongly, and it should also be measured. But when we're looking at the number one measure of alcohol consumption in a country, it should be adult per capita consumption because it correlates with harms the most. It's the most effective in terms of measurement, and it's the least costly. Another example I want to give you is the impact of COVID-19 on alcohol use. By looking at sales, we could immediately see the impact of COVID-19 on alcohol use. And this is really important for getting a fast, responsive look at what's going on in a country. So if you implement a policy, you might not see things like cancer deaths, liver cirrhosis deaths, et cetera, decrease right away. That might take a year, 2 years. In the terms of cancer, it may take 10 years to respond to alcohol policies. Whereas when we're looking at adult per capita consumption, we can see it right away. If you're measuring your adult per capita consumption like some countries do, which is on a weekly or monthly basis, you can see an immediate impact of those policy changes, as well as other global events like COVID-19 on alcohol use. The other one that we could see immediately was the 2008 financial crisis. We could see an immediate impact of that financial crisis on alcohol use. And so it is a measure that relies on existing data. So it's extremely cost effective and it's extremely responsive in terms of the time between the policy. So it could be a policy or an event and the measurement of its impact. So how do we measure adult per capita consumption? And this is really important in terms of these different domains, because some countries do certain ones really well and other countries don't do the measurement at all, which we would need to rely on expert opinion. And that's something that we wouldn't want to do. We would want to actually have data to measure that adult per capita consumption. So I have recorded APC, that is measurement through sales and production statistics. Unrecorded adult per capita consumption, that's alcohol that is consumed but not recorded in either government or industry surveillance systems. And then lastly, tourist APC, and that's alcohol sold in countries but consumed by non-citizens. And this is extremely important for the Caribbean countries, and I'll get into that in a little bit as well. So recorded adult per capita consumption, we can see here, recorded adult per capita consumption is fairly high in the Americas, and it varies within the region, with Canada, the United States, and Brazil having particularly high recorded adult per capita consumption. However, that's not to say that this is a stable situation. We know with economic development, adult per capita consumption is expected to increase in all other countries in the Americas. So how do we get this data at the WHO? Well, we rely on various data sources. National government data sources are the most important data sources that we have. They're the gold standard. If we don't have those, we rely on other industry-based recording agencies. So we have things like Global Data, IWSR, and what they do is they're industry paid. So they're set up by industry and paid by industry to monitor alcohol sales in a country. Now, that data is a black box. We do not know what's going in, and we do not know how it's being processed. So that data we only get published by IWSR, but we have no idea what is going on with the data, what adjustments are being made to the data. They often adjust for cross-national smuggling, which may or may not have a lack of evidence. They often also adjust for things like counterfeit alcohol, which there is almost a complete lack of evidence in terms of how much is going on there. So it becomes a problem because with ownership of the data, the national governments can make sure it's transparent and accurate. And therefore, we can make sure that what we're reporting is correct. And when the governments also have access to the data, they can then also have ownership over it and implement policies that will change it as well. So what countries do have recorded APC data and what countries don't? Well, we're getting more on board. And since the launch of the PAHO tool to track APC, it's improved immensely. But there are many other countries still that don't measure recorded APC. This is a map that will be published with the upcoming global status report, and it's as of that global status report. We now do have data from Colombia as well. So it's a situation that's improving over time. It's not just stable, but there are many countries in the Americas that could benefit from measuring recorded APC. So how do you get to that level of measuring your APC? Well, we have specific taxation systems. So your tax systems, they capture the volume of alcohol sold. The value of alcohol sales does not directly provide information on alcohol use as surveillance systems, but usually taxation systems will capture the total volume of alcohol sold. And this is great. This can be used to calculate APC. But what's needed is collaboration between departments. So you'll see here, I mentioned that the Ministry of Health or Department of Health in a country is unlikely to possess the data required to estimate APC. So as a Ministry of Health, the Department of Health, if you are in that organization, you're going to need to reach out to the finance department or the statistics department or other departments that do have the data necessary to report that APC. Usually these departments of finance and statistics aren't usually interested in reporting the amount of alcohol sold in terms of a liter base of pure alcohol, because that's not what their job is. And so as a Department of Health, you can work with the departments of finance and statistics to actually get that data to report the total volume of pure alcohol sold in a country. So the recorded alcohol. There are various things that you also need to account for. This is all in the tool: alcohol production, imports, exports, duty-free sales, and sometimes you have certain things like re-exports and stockpiles, but those are optional. That's not captured in a lot of countries. What's important are those top 4 indicators, and those are usually all available from the statistics department or finance department. The next thing you need to know is that when the finance department usually gives you this data, they give you it as in volume of beer, volume of wine, volume in spirits. You'll see that a liter of beer isn't necessarily equal to a liter of spirits. We know that spirits has a lot more alcohol per liter than beer. So what needs to be done is you need to adjust it per liter of pure alcohol, because the ethanol or pure alcohol that's contained in that beverage, that's what's causing the harm. And so there needs to be that adjustment. And this is included in that PAHO tool as well. There's also a need that when you're looking at the volume of alcohol, it's usually reported in liters. But when we're talking about standard drinks among our citizens, those are usually reported in grams. So what's needed here is a conversion of liters to grams when you're talking about standard drinks. So if you want to report your APC, which is usually in liters, and put that in reference so people can understand it in terms of, well, how many drinks does that equal a year or a week among the average citizen? You can use these formulas, and these are all provided in the APC tool as well. Next, unrecorded adult per capita consumption. And this is an extremely important area that's often overlooked in a country. And there's a lot of work needed to be done here in every country, including high-income countries of the United States and Canada in the Americas. So it's not a problem of just low and middle income countries, high income countries, and very high income countries, they have a problem here too. So if unrecorded adult per capita consumption, it varies within the region. Not only does it vary in the region, but the data sources vary. There is extremely limited data available in terms of the volume of unrecorded APC. So this is data on artisanal and home production, surrogate alcohol, so things like mouthwash, cross-border shopping, large-scale smuggling, industry and illegal production. Accuracy of measuring unrecorded poses a big challenge in terms of these ones, because the government isn't tracking this data and industry isn't tracking this data. So how do we get at this? Well, one way that I really don't like is the use of experts. In absence of any other data, we will use a group of experts coming together and telling us what they think that value is for a country. So what fraction of alcohol consumed in a country is unrecorded from these other sources like artisanal and surrogate alcohol. But the best way to do it, and many countries don't do it, and it's extremely inexpensive to do, is population surveys. By merely adding a couple questions to your survey, and this is in the tool as well, on do you consume unrecorded alcohol and how much do you consume? So it's about 2 questions. You can estimate unrecorded alcohol in your country. And most countries in the Americas have regular surveys that they could add these questions into. And here's just an example of the data availability on unrecorded APC. There are very few countries globally, and especially in the Americas, with the survey data available. The survey data is the most accurate. Otherwise, we're relying on expert opinion. And expert opinion, if it's not based on any real data, it's not great. It's the best we have, but we could do much better. So here are the population survey questions. You can see it's just 2 questions. It's fairly straightforward. It's not that expensive to add to your survey. This has also been translated into Spanish. It's from what's called the STEP survey. And that's where we have that data from. But outside of the STEP survey, it's not measured in any other surveys, but it's extremely important to tracking APC in a country. What also can happen is we can estimate the sources of APC unrecorded in a country. And you can see it's not the same for every country. We have home production being really high in Guatemala, United States, and Brazil. But in other countries, like in Mexico, it's mainly coming from illegal production and surrogate alcohol. So the response that you would do to decrease your unrecorded alcohol may be very different. For Mexico, you might promote more enforcement against illegal production of alcohol. But if you're looking at a country like Guatemala, illegal production isn't a problem. What's really causing the problem is home production. And how do you tackle that? Because that may be culturally relevant. So there may be not much you can do about that in Guatemala except monitor it. But for other countries, things like illegal production, surrogate alcohol, and brought over the border, that can all be dealt with through effective alcohol policies. So tourist adult per capita consumption, this is extremely important for the Caribbean countries as well. It's currently estimated on the flow of tourists between countries, the average length of stay, and the usual amount of alcohol consumed by citizens or permanent residents while in their home countries. I can tell you as a Canadian, if I go visit a Caribbean country and I stay on a resort, I see people drinking much more alcohol when they're vacationing than when they're in their home country. So we are largely underestimating tourist APC for Caribbean countries. And this alcohol consumption isn't harm-free. A lot of assaults and injuries can occur when people consume alcohol when they are away from their country of the origin. And therefore, it's a really important thing to measure as well in terms of the harms that can occur to people in different countries. So as I said, there is a potential impact of tourist consumption on injuries, including interpersonal violence, and this can contribute to hospitalizations and costs. Collecting data on tourist consumption is not a standard practice. And so there's really a need and a necessity to develop innovative approaches to measure tourist APC. And such methods should take into consideration the tourist alcohol use. So you can do surveys, but those are quite costly. Another way to do it that we've been experimenting with is during the COVID-19 crisis, tourism flow decreased. And then we can see how much alcohol use decreased because of tourism flow. And therefore, we can get a better estimate of tourist APC. And using that method, we see that tourist consumption is much higher than we previously thought. So the importance of estimating alcohol attributable deaths. APC is the critical underlying component of estimating alcohol attributable deaths. So deaths where we look at alcohol poisoning, we know that if a person didn't consume alcohol, they wouldn't get alcohol poisoning. It's obvious that poisoning is due to alcohol. Without alcohol, there's no death. But how do we get at other causes of disease like cancers, infectious diseases, liver cirrhosis? Well, we have to look at the risk of the exposed group, which are usually past year drinkers. They're consuming a certain amount. And then we compare those to lifetime abstainers. So in this fictional example, we have relative risks, which are obtained from meta-analyses that says that current drinkers who consume a certain level are at 2.4 times the risk compared to a lifetime abstainer. If we have 24 events in a population per 100, we would expect only 10 events per 100 in the unexposed population. So that's how we get at those 14 per 100 individuals. And that gets us to the attributable burden. And this is the exact same method that we use when we do the global burden of disease. So this gives us the absolute scale, and then 14 excess events here. You can see 24 compared to 10. The 14 divided by 24 gets us the attributable fraction. So in this fictional example, 58% of the burden is attributable to alcohol consumption. And that's very similar to what you would see for a disease like liver cirrhosis. Alcohol is by far the most influential risk factor in most countries for liver cirrhosis, and the attributable fraction can get quite high. So what's the take-home points here? Many countries lack the means to measure recorded APC directly and instead depend on industry data systems. This is not great. There's no transparency. And so you're at the whims of alcohol industry when you're monitoring your alcohol use over time. It's extremely cost-effective to measure recorded APC, and it can be done very easily. But for the Ministry of Health, you have to contact the Ministry of Finance and the Ministry of Statistics usually, because that's where the data are going to be located. Accurate data on recorded APC, and this is a side point, but for low alcohol content beverages, which are now being pushed by industry and public health folks alike, is essential for evaluating the efficacy of promoting such beverages as part of alcohol policies. It's also just the most responsive indicator. So any policy that you implement, recorded APC is going to be the most responsive and will give you almost an immediate feedback on that policy. You're not going to see it in deaths and surveys. Surveys take time to implement. Recorded APC will give you much quicker and cheaper data and much more accurate as well. Improvements are needed in terms of measuring unrecorded alcohol use. This can be done simply by adding 2 survey questions to population surveys and would eliminate the need for the WHO and other countries that use the WHO data to rely on expert opinion, which would be much, much better. And lastly, innovative and novel approaches are required to effectively measure APC specifically for tourists. So for those Caribbean countries, there's a need to maybe do surveys or look at the COVID-19 crisis and how that affected tourism flow and APC to really get a handle on how much are tourists consuming in your country. Now, we're probably not going to have a COVID-19 crisis again for a while. So the most effective way to do this longitudinally right now would be surveys of tourists. particularly maybe when they're exiting the country, on how much alcohol they consumed while they're in their country, your country. And that would give you a really good indicator of how much alcohol is being consumed by tourists as compared to residents of your country, because the alcohol consumed by the residents of your country is extremely important, but the alcohol consumed by tourists is also extremely important as well in terms of public health. And with that, I'll end my presentation. Thank you.
Gracias, doctor Kevin, por su presentación. Se nos deja unos datos bien interesantes.
You have given us very interesting data. You tell us the importance of measuring the APC among adults in such a way that the results are related to the potential harm and disease resulting from alcohol consumption. You have also underscored the components of the indicator and the relevance of the information by governments and the collaboration work that should exist at different government levels in order to obtain results of this per capita alcohol consumption resulting from the actual reality of consumption in each one of the demographic groups and the realities in countries. Vis-a-vis this, there's a question in the chat as regards to the information that we have on this topic. Kevin, would you like to respond to this question? Perhaps a participant has told us that some information from the country show a decline in consumption, but those countries have no policies to reduce consumption vis-a-vis other countries that have developed policies and there is an increase in consumption. What can you see as a result by these results? What can you tell us?
So there are various factors that affect alcohol consumption at the population level, not just policies. And that's why it's extremely important to track it over time, because these factors can change. For example, one of the most interesting, not policies, but events that has absolutely decreased alcohol consumption to a low level has been the financial crisis in Venezuela. The financial crisis in Venezuela is by no means an alcohol policy, but has caused a large decrease in alcohol use. There's also other factors over time that can decrease alcohol use. The increase in urbanization is related to a decrease in alcohol use as well. So underlying trends in alcohol use are complex and can be affected by many, many, many different factors, not just alcohol policies. And that's why it's really important to track them over time. In terms of the most cost-effective ways to reduce alcohol consumption and things that you have control over, you don't really have control over a financial crisis. You don't really have control over when COVID-19 is going to occur. But what you do have control over as a government is the policies related to alcohol. And this can cause a huge shift in adult per capita consumption. And this shift in adult per capita consumption will eventually lead to an immediate and then long-term, especially with things like cancer, reduction in alcohol attributable harms.
Muchas gracias, Dr. Kevin, por su presentación.
Thank you, Dr. Kevin, for your presentation and your answers. We truly appreciate your participation in this webinar. Now we welcome Norman Maldonado, an economist. Has a doctorate in economics from Ohio State University. He's been the director of research of centers in research of economy and public health and the Center for Economy in the ICESI University, as well as the Valle de Lili Foundation in Colombia. In 2 consecutive presentations, Norman will be telling us initially about the basis and variables necessary to estimate the APC. And in a second session, he will tell us about the practical means to calculate the indicator and make use of its results as an input in order to have public policy decision-making on this in this area and countries in the region. Norman also will have the support Juan Camilo Herrera, a Proesa researcher who is broadly experienced on these topics. I thank all participants who are with us today. We let you know and answer by saying that we'll have a possibility in our links for the documents that Juan Tello mentioned in his presentation. And in addition, the two presentations, both in English and Spanish, that we be made available this afternoon in the YouTube channels. Dr. Norman, you have the floor. Go ahead. Thank you, Mario, and thank you to the whole team for inviting us to this meeting of great importance for the region. I will be sharing my screen with you. Can you see it now? Yes, we can see it clearly. Thank you, Norman. Wonderful. The idea of these two presentations is to land many of the concepts that have been mentioned in previous presentations and what happens in the specific case of Colombia. This is very important, not only as regards cancer, but this is the only means or standard to do so. And the different ways in which it can be conducted, and what are the most precise means to do it. I speak about the case of intermediate and immediate high levels of income and having access to the information. And at the end, we know that this calls for the participation of all of the members of society, the academy, civil society, and different government agencies, ministers of finance, ministers of statistics, in order to place this information in the same place and be able to measure the problem. Let me begin with this slide, where I tell you the crucial problem we are facing and trying to resolve, measure, and estimate the amounts of how much alcohol is being consumed in our countries. How many liters of alcohol and pure alcohol, therefore, are being consumed in our countries? And that is the purpose, the main issue that has to be resolved. There is no single answer that we can give to it. Until we have the information, we may have more accuracy, as happened in the case of Colombia. Let me begin by the end. As regards this information, here you see the figures, and with this we will be closing the two presentations. In the case of Colombia, we have up to 2021, 2,800,000 for beer. For spirits, 127,000 with an amount of 50 million, 37 for whiskey, and also for wine and consumption, where we have 13 million. And this gives us a total for alcohol beverages, where you see 39 million, 3 million rather. These drinks have a concentration of alcohol, as you see here, beer 4%, spirits 29, rum, whiskey, sabajon, gin, vodka, etc. You see the figures for each one of these categories, where you see the corresponding number of liters of alcohol. 112 consumed of beer among Colombians, 41,000 spirits, and 158 million liters of pure alcohol, which is being consumed by the population of Colombia. Take this 158 million, dividing them into the population 15 or more years in Colombia, country of about 50 million inhabitants. We find that the adults are 30 million. Here we have the indicators per capita of 4.03 liters pure alcohol per annum year. And how do we come to this indicator in each one of the countries? I will tell you about the experience we've had in Colombia with several considerations. As I said earlier, the main variable in order to deal with the amounts, and there was how many liters of the different alcoholic beverages are being consumed, as was indicated. Some measured through service of direct consumption or apparent consumption, what has been found following international practices and best practices for utilizing the information and the official statistics on production, which deals with any possible bias, and also the surveys carried in households. In Colombia, we've followed also apparent consumption and other information given by the Department of Statistics, where we record this information for Colombia, also of non-registered alcohol production. But it is difficult to do this in the case of Colombia, which it dates back to 2010. But we still, as a society, have a task to continue to measure this more often. And this is important because there is a single good information source. What we try to do is to be able to make well-informed decisions and see what has actually worked in our country. And this is one of the conclusions that can be reached, and this will be different in each and every country. Very well then, as was stated, as I stated in the beginning, keeping with global trends, local information, and therefore how active can local actors be in interpreting, digesting, and processing that information is something which is paramount. It is difficult otherwise to have an updated information of all the information that exists, but the local actors are in a position to do so. Perhaps local information plays a very substantial role in order to respond to this WHO requirement regarding diseases and other problems we have. Very well, Norman, would it be possible for you to get closer to the mic so that the interpreters can hear you a little bit better? If you don't have a headset or a microphone, the interpreters will hear, because we hear you with a certain degree of echo. Yes, now we try to be as close as possible to the mic. Please get as close to the mic as possible. What is required for the estimation of the APC? First, the definition of APC as regards priorities in the country, question which is asked by way of an indicator, and the local information available. That's to make an estimation of the denominator. As you remember, is how what is the amount of alcoholic beverage in the country, and how many liters of pure alcohol are consumed. And then moving on to how many people 15 years or older, adult population, in other words, give us the information for our country. Okay. So vis-a-vis the APC definition, we saw the need of research in regards policies, which showed us the following. We have a global monitoring exercise according to the 3.5.2 GPS, and we don't have any policy that allows us to have a follow-up of per capita alcohol consumption. Therefore, member country of WHO, such as Colombia, within its framework policy, the monitoring framework is there. In order to measure alcohol per capita consumption is indeed something which is basic. So there's a divide between the policies on the one hand and the estimation of consumption. Then we have other information where our connationals are telling us there's consumption of minors under 15 years of age is reducing. Some start at 7, which is a very low age level. We also have a diversity of products with a whole series of products in the industry, substantial number of products with a low alcoholic content, as some other products have been seltzers and also and others. But as we see, this accounts for 95% of the market, which is beer consumption with an alcoholic concentration of 4%. What is the question we must answer? That has to do with global and local monitoring. Regarding global monitoring, to have WHO reports to place Colombia within alcohol control in regard to the rest of the world, and doing it locally to see how that consumption of per capita alcohol is taking place in Colombia. Vis-a-vis global monitoring, we have to respond how many alcohol liters have been consumed by persons of over 15 years of age. And since we have this type of information, such as consumption for children under 15, we also have unofficially recorded alcohol consumption and other elements of information that have to be taken into account when carrying out local monitoring. What do we have in the numerator? Well, the total number of liters of pure alcohol consumed per year in Colombia, and the denominator with the population figures. What is the information that we have available for this purpose? Vis-a-vis non-registered alcohol consumption, we don't have an updated average. We have other surveys which are applied in Colombia that throw some light, but we must bolster these systems for non-registered alcohol consumption. We also have information regarding taxes, as we said in Colombia, and this is being about 20 to 30% of the total measurement is obtained through the taxes. So we have to resort to other types of information that will allow us to have an evaluation of apparent alcohol consumption and also psychoactive substances. And we don't have public information as to the amounts being consumed, considering products by their brand. In the case of medium income level like ours, we still have important gaps, but we must carry out monitoring and be able to have a better measurement as accurate as it might be possible. So vis-a-vis these estimates of the numerator, we have apparent consumption levels. And what we do in Colombia is we go to the records and the official surveys by the Department of Statistics to calculate how much of the alcoholic beverages are being produced in the country and how much of that is actually being exported to other countries and how much of it is being brought from other countries. And that figure includes all the information, and it deals with the problems that demographic surveys present, but also takes into account the fact that the system in Colombia nowadays is not does not necessarily tackle and deal with all alcoholic beverages, where we have also local production. But other beverages such as wine, we don't have much information. So taking into account the production and the importation and export records, we have a good source of information from the Department of Statistics as to the amount of alcoholic beverages. Vis-a-vis alcohol content, we have 4 points of information. Fiscal authorities, Ministry of Finance, provide information, specific information regarding the amount of alcoholic beverages, and our health authorities, as in the records of foods and beverages, tell us what is the content of alcohol recorded for each one of the products in the market, and it is thus possible to have a informatic registration in the webscape in order to get information regarding alcohol consumption. And this is a definition which is very interesting. All of these present many advantages, undoubtedly. We also face limitations in some instances because we have a backlog 1 year or two, and we have to carry out resolution with better accuracy. The records of foreign trade are quite good, and they present information of products coming into the country. And when combining all these sources, as far as alcohol content, we can conduct the necessary estimates. Well, having given you this information for the numerator, in the denominator now, we do have information which at the demographic outlook of the statistics department, the advantage of having very long time horizon. Also, presentation by age and sex, and the limitations that you see right here. And these are all issues that could become a problem. So this is the overview that we have gathered, and thus we can move on to the next presentation with a specific message. And I think it is important to mention the role by all of the local actors in order to be able to have an adequate measurement of how many liters of alcohol we have and what is the population which is exposed. That is basic. It is difficult otherwise to have adequate traceability of what is being produced. But the local sector plays an important role in this strategy, and also with regard to the global strategy. So at least as PROESA and the Academy, we have decided to take this initiative of following this as accurately as possible for Colombia, starting producing results that will be valid also worldwide to implement several of the effective interventions. And to play an active role with this, I come to the conclusion. We move on to the specific details for Colombia. I yield the floor to my colleague. Go ahead.
Gracias.
Juan Camilo, bienvenido. Para, para efectos de la traducción, tratemos de hablar un poquito
Juan
pausado.
Camilo, welcome. Please speak more slowly so that the interpreters can follow you correctly. See, we can hear you well. Thank you.
Muchísimas gracias. Bueno,
Thank you very much.
entonces,
So,
como lo decía Norman,
as Norman was saying, we are now speaking about the specific numbers for Colombia and talk about more practical things. And I remind you, these data is for 2021, which is the most updated information we have for this country, for our country. Let's begin with the numerator. The question we have to answer is, how many liters of alcoholic beverages are consumed in Colombia? And the source information for this is the DANE, the National Statistics Office. In other words, the National Statistic Office of our country. We use the Manufacturing Production Survey for 2021, which informs us of the natural production of alcohol. To that, we add imports, a number of imports to the country that are not produced nationally, and we reduce the national exports that leave the country. So exports represent very little in this measure, at least for Colombia. So to summarize what Norman said at the beginning of the presentation, beer is 2,812,000 liters, spirits 127 million, and wine 39 million liters. Here you can clearly see that more than 90% of that total of almost 3 million is beer in 2021. And the question is, how did we obtain this data? Here you have a list, step by step, 9 steps. And if you look at the detail, you see that we can begin with national production. National production, stage we followed was we went to the DANE Statistics Office page, the annexes on import. We could break down into microdata if you would like to know each registry, each variable, but we feel that the annex is enough. Then we look at sheet 6.2, which contains production and sale of articles during the year. That production is codified with a CPC classification, central product classification. And then we identify what type of classification in that annex are what we need for alcohol consumption. We add various categories. So for instance, in the case of beer, we added 3 categories of beer: Pilsen type bottled beer, canned beer, and black beer. If in your country you have a similar survey or statistical operations such as this, and you use CPC classification, you will most likely have these 3 categories of beer. And once you obtain national production, you then look at imports and exports. Again, we go to the Dane webpage, the statistics office. We look at foreign trade and the microdata. We download that microdata, the annexes that are presented by the statistics office are not enough, so we look at microdata. Now, one exception is that the information is presented on a monthly basis. So if you want to compile the entire year, it's important to add up the database for the entire 12 months. And then the products, unlike the manufacturing survey, are coded not by CPC classification, but by their tariff categories, which is what foreign trade products are usually categorized. Once you identify the categories, you try to compare it to the CPC. For instance, in the case of beer, we try to find which record there is for beer, and then we add the information to compare it to national production. Once we've done this step by step, the apparent consumption is the total number of liters, 3,098 that I mentioned earlier, and then the take production plus imports minus exports, and that gives us the 6 million liters. With that, we have obtained the first column, the left, liters of alcohol consumed. So then the question is, how do you move
alcohol puro? Como lo decía Kevin y lo repitió ahorita Norman, necesitamos el contenido de alcohol que tiene cada bebida. Puntualmente para Colombia, esta es una de las mayores desagregaciones que logramos obtener, y la pregunta es entonces, bueno, esa información, ¿de dónde se obtuvo? Entonces, en el caso de nuestro país, revisamos 4 fuentes de información. La principal o la que encontramos más acertada es la página del INVIMA o el INVIMA, que es el Instituto Nacional de Vigilancia de Medicamentos y Alimentos. Ahí es donde se encuentran los registros sanitarios que mencionaba Norman, dado que cada producto, para poder ser comercializado oficialmente en el país, debe tener un registro vigente que le da el INVIMA, y por tanto ellos tienen la información sobre cada uno de los productos. Puntualmente para las bebidas alcohólicas, esta información es muy importante porque adicional en el registro dice el contenido alcohólico que tiene cada producto. O sea que ahí es una primera fuente de información oficial que logramos obtener. La segunda son los supermercados de referencia en el país. En el país tenemos varias cadenas de supermercado de grandes superficies, y eso se pueden rastrear fácilmente vía web. Adicionalmente, también hemos hecho un ejercicio que lo hemos llamado sondeo de precios, y es básicamente ir incluso presencialmente a los supermercados y ver los productos, y de ahí también se puede obtener la información por las etiquetas nutricionales de cuánto contenido alcohólico tiene. Y finalmente, una fuente de información muy valiosa es que en Colombia el Ministerio de Salud tiene un decreto donde define cuántos grados de alcohol debe tener cada bebida, un intervalo de grados de alcohol. Entonces, si no se tuviesen las fuentes de información previas que he mencionado o ese ejercicio, una fuente que se podría visitar es esta reglamentación del Ministerio de Salud. Entonces, ya con eso, logramos tener el contenido de alcohol que se le aplica a los litros de consumo, calculados como consumo aparente, los 3.098 millones de litros, y aplicando esos porcentajes a cada una de las bebidas, se logra obtener los 158 millones de litros de alcohol puro. ¿Qué nos queda faltando en este caso? La población, ¿verdad? Que son los 39 millones de habitantes. Entonces, si uno mira el paso a paso para obtener esta población en Colombia, nuevamente se debe de ir al DANE, que es la Oficina de Estadística. En este caso, ellos cuentan con retroproyecciones y proyecciones de población, que, como lo decía Norman, abarcan un horizonte de tiempo desde 1950 hasta 2070. En este caso, como hablamos del 2021, el total de población proyectada por el DANE para ese año era de 51.117.378 habitantes, de los cuales 11 millones son menores a 15 años, es decir, este valor no se tiene en cuenta en la ecuación, y lo único que resta son los 39.401.000 que pertenece a la población con edad igual o superior a 15 años de edad. Los pasos para obtener esa información, nuevamente, fue ingresar a la página web del DANE, esta vez en la parte de proyecciones de población, con base en los censos poblacionales, y de aquí se descargan los anexos que están desagregados por edad y por sexo. Aquí lo que hay que buscar es asegurarse bien de tener el año de referencia, en este caso 2021, y que la información que se tome sea a partir del corte de edad, en este caso para mayores a 15 años, mayores o iguales a 15 años. Se agregan todos los datos y con eso se obtiene la población mencionada de 39 millones de habitantes. Y ese sería el paso a paso que quería contarles. No sé, Norma, si quieres adicionar algo. Muchas gracias.
Gracias, Juan Camilo. Quisiera cerrar con lo siguiente. La experiencia de Colombia, un valor agregado que tuvo como academia ir a fondo en esta medición y poder tener estimaciones confiables fue poder usar esta información para hacer un buen diseño técnico de impuestos selectivos al consumo de productos de tabaco. Como se mencionaba al comienzo, los impuestos selectivos son una de las herramientas efectivas para controlar el problema. Colombia, como academia, se hizo un trabajo intenso en poder hacer un diseño adecuado que respondiera a las particularidades del problema que tenemos en Colombia en consumo de alcohol, y ese diálogo de política está abierto. Entonces, lo menciono porque solo el ejercicio de monitoreo, además de caracterizar, permite abrir unos canales de diálogo de política que en el caso de Colombia han sido muy útiles para posicionar frente a las autoridades sanitarias la discusión en general de avancemos en la implementación de las intervenciones efectivas que están en el paquete SAFER, que están en las lineamientos de intervenciones efectivas de OMS, y en particular en la implementación de impuestos selectivos al consumo de productos de tabaco, de cómo el país puede mejorar su regulación, su diseño de impuestos para poder usar los impuestos como un mecanismo de protección en materia de consumo de alcohol. Solo mencionar eso. Muchas gracias.
Bueno, Norman y Juan Camilo, muchísimas gracias por su presentación. Sabemos que el tema no es fácil, que necesita más apoyo práctico, pero en este primer seminario virtual hemos querido iniciar el trabajo con la región, con los países de la región, para que tengan interés en involucrarse más en el tema, para que de alguna manera reconozcan que es un trabajo de varios departamentos, de varias instancias de los gobiernos, no es solamente de los ministerios de salud, se requiere el trabajo de los ministerios de Hacienda, de los ministerios de Economía, de los ministerios de Comercio, de las entidades que manejan los impuestos, para de alguna manera lograr una información que sea válida en los países y puedan tener un monitoreo de cómo va el consumo de alcohol en cada uno de los países. A continuación, les vamos a pedir su presencia en los últimos 10 minutos. Estamos algo atrasados, pero el tema que sigue es bien importante. Leonardo nos presentará, Leonardo García, especialista en los temas de alcohol y adicciones y actualmente consultor de nuestra oficina de la Organización Panamericana de la Salud en Colombia, representación a la cual agradecemos de antemano su apoyo y participación. Leonardo nos va a presentar como ilustración complementaria de este seminario virtual los objetivos y contenidos del curso disponible en el campus virtual de salud pública sobre el tema que hemos desarrollado en el día de hoy. Este curso puede ser complementario y con seguridad de mucha ayuda para que ustedes, los participantes de este evento, puedan fortalecer su conocimiento en el tema. Tiene la palabra, Leonardo.
Muchas gracias, doctor Mario. Muy buenos días y tardes para todas y para todos. Y bueno, como estaba planteando el doctor Mario Zapata, la idea es poder rápidamente invitarles y sobre todo motivar a que puedan complementar toda esta temática que hemos estado viendo en la mañana de hoy con un curso que se encuentra alojado en el campus virtual de salud pública. Ustedes pueden ingresar por medio de este código QR a este espacio de la Organización Panamericana de la Salud, que básicamente es un espacio pensado para alojar un número significativo de múltiples cursos que son en su mayoría de autoaprendizaje y muchos de ellos orientados a la temática que hoy estamos viendo que tiene que ver con alcohol y otras sustancias psicoactivas. Los invitamos a que conozcan el campus virtual de salud pública. En este, como les decimos, pueden encontrar un número muy amplio de diferentes cursos que de seguro podrán ser de sumo interés para cada una y para cada uno. Dentro de esta oferta, pues van a encontrarse con este curso llamado Estimación del consumo de alcohol per cápita en las Américas, que básicamente tiene como objetivo poder dar información detallada sobre las fuentes que se requieren para poder hacer el cálculo de este indicador, pero además también poder encontrar la metodología de cómo poderlo llevar a cabo. Es decir, básicamente en este curso ustedes van a encontrar toda esa información que las presentadores anteriores, pues básicamente nos estaban informando o presentando. ¿A quién va dirigido este curso? Este curso, pues básicamente va dirigido a cualquier persona que tenga interés en el tema. Pueden ser trabajadores de la salud, investigadores, estudiantes, estadísticos, salubristas, epidemiólogos que trabajan en relación a enfermedades crónicas no transmisibles, al alcohol como factor de riesgo y también, pues como tal, al uso de bebidas alcohólicas como sustancia psicoactiva. Este curso en particular tiene una metodología de autoaprendizaje, es decir, usted puede matricularse en cualquier momento y básicamente llevar el curso o desarrollarlo a medida de la disponibilidad de su tiempo y de su espacio. Es decir, no va a ser un curso tutoriado. Aquí vale la pena aclarar que muchos de los cursos que están en el campus virtual, algunos son tutoriados, otros no lo son. En este caso es un curso de autoaprendizaje, en el cual ustedes van a encontrar además una serie de recursos que les van a permitir poder como adquirir esas competencias tanto conceptuales y prácticas, pues de manera seguramente más pedagógica. Eh, Pueden acceder al curso también, digamos, de manera directa por medio de este QR. Pueden escanearlo, de hecho, en este momento con su móvil. Pero si no puede usted escanearlo con su móvil, usted puede buscar en Google Campus Virtual de Salud Pública y agregar el nombre del curso, en este caso, estimación del consumo de alcohol per cápita. Usted puede buscarlo así, entonces, Campus Virtual de Salud Pública, OPS, estimación del consumo de alcohol per cápita y de manera directa, digamos que el navegador la va a llevar al curso, si no, puedes perfectamente escanearlo por medio de este QR. Con las personas que realizan este curso, básicamente se espera que puedan tener como 4 grandes resultados de aprendizaje. Uno, poderse familiarizar con las fuentes de datos necesarias para calcular este indicador. Es básicamente lo que nos estaban presentando Juan Camilo y Norma hace unos minutos. Poderse familiarizar con la herramienta para poder llevar a cabo ese cálculo, comprender la necesidad y por qué y el para qué es necesario este indicador. ¿Sí? Y claramente poder recopilar datos nacionales para poder utilizar esta herramienta y poder informar sobre el indicador. Es decir, en últimas lo que se está esperando es que las personas que realicen este curso puedan desarrollar algunas competencias, tanto conceptuales y también algunas competencias prácticas en la implementación o en el cálculo de este indicador. Este curso se conforma de 5 módulos en los cuales ustedes van a navegar inicialmente en una introducción en donde vamos a hablar del para qué y por qué es importante el indicador, cómo de alguna manera esto se relaciona con las políticas nacionales y también, por ejemplo, con la encuesta global del alcohol. Un segundo módulo en donde se va a hablar del consumo per cápita en adultos. El tercer módulo ya entrar a hablar como tal de la herramienta. Un cuarto módulo en donde se podrá mirar el uso de la herramienta, poder avanzar con ese cálculo del indicador y poder en el último módulo encontrar algunos ejemplos prácticos de países en nuestra región. Creemos que este, digamos que es un recurso muy importante. Los invitamos por favor a que pues puedan ingresar, puedan matricularse. Quienes no conozcan el campus virtual, ustedes al inicio crearán un usuario, les van a pedir, digamos que información básica, información, por ejemplo, con nombre y apellido, que es muy importante porque todos estos cursos son certificados. Y en este caso, creemos que de alguna manera complementa de manera importante y relevante esto que hemos estado discutiendo esta mañana, invitarles también a que ustedes puedan compartir este recurso con otros actores que ustedes consideren que son claves, como decía el doctor Mario hace unos minutos, no solamente con actores del Ministerio de Salud, sino seguramente también del Ministerio de Secretaría de Hacienda, de otros ministerios que ustedes consideren y otros actores que ustedes consideren que es relevante que tengan esta información. Además, digamos que en el campus virtual tenemos otros cursos. Hay una variedad significativa de cursos que trabajan en el tema de alcohol. En este caso, por ejemplo, el doctor Juan, digamos que en su presentación también nos hablaba de la estrategia SAFER, invitarles, por ejemplo, a que puedan también ir y conocer este recurso que de seguro también complementará toda esta información que hemos estado viendo durante la mañana, otros cursos que hemos desarrollado como para la prevención del consumo de sustancias psicoactivas, y de verdad que hay una amplia variedad de recursos importantes en el tema de alcohol. Acá no se encuentran todos, pero queremos invitarles y sobre todo motivarles a que ustedes puedan consultar y claramente también compartir con las personas que ustedes consideren relevantes. Muchísimas gracias y que tengan un feliz día.
Bueno, muchísimas gracias, Leonardo,
Well,
por su
thank you so very much, Leonardo, for this presentation. We express our gratitude for the presence of all participants in this virtual seminar. Thanks again to the presenters. We extend to you our gratitude, and we invite the participants very especially to participate also in the series of virtual seminars that we have in the field of mental health that we're now developing, and that will supplement all of these topics like the one we're discussing here today. Thank you all for your presentations. Thank you for having remained with us during an hour and 45 minutes for this meeting. And in coming meetings, we will be participating with regard to other topics and the tasks that we all play in each one of the countries, especially as regards this very important topic for public policy, which has to do with decreasing alcohol consumption against the population, and directly and indirectly to diminish the burden of disease and the burden of death resulting from alcoholic beverage consumption. Thank you very much. May you all have a good day. Bueno, el primero de los colombianos, aparte de que sonaba como que estaba en una caverna, tú les dijiste, me imagino.